is 7 out of 10 people will require assisted living care in their lifetime. Let that sink in for a second. 70% of people in their lifetime will have to require assisted living. Hi, this is Joseph Pate, better known as Medicare Joe, and in today's video we're going to be talking about skilled nursing care, assisted living care, and why it's important to understand the costs and exposures of this type of care. For me, it's something I'm super passionate about because nobody's talking about it, and that's just mind-blowing to me. Something that can cost seniors hundreds of thousands of dollars out of pocket, and nobody's mentioning a word of it. So today's video, we're going to jump into what it is and how you can cover yourself on that. But I'd like to take a moment, if you're new to this channel, click the red subscribe button in the bottom here. That will notify you whenever our Medicare Joe team here posts any new YouTube videos about Medicare, so you can be updated to watch those. I'm going to make this video to be about 5 to 10 minutes. We'll see how long we can get into it here, but mainly we're going to be chatting about nursing care, assisted living care, and home health care. And why is this stuff important? I'm going to post this statistic right here. CNBC did this back in 2021, so it's a few years old, that the average cost of nursing care for the year was $108,000. The average cost of home care was $60,000. And many of you may be thinking that your medical plan is going to cover that. Well, it does to an extent. So if you are getting onto Medicare, you have an employer plan, or you have a retiree plan. This is relevant to anybody that has any type of medical coverage. For skilled nursing care, so where you are receiving rehab or treatment in a nursing facility, Medicare with the supplement, your employer plan, or retiree plan with Medicare will cover up to 100 days of care. After that 100 days, that is it. You were on your own to come up with the cost of care for the rest of that time you're in there. Assisted living, this is where you maybe just need a room and some help from time to time. You're not in rehab technically. There's no coverage for that at all on any type of healthcare plan. So if you just are, aging, getting older, you need help, you don't have anyone that can come in and help you out, and you want to go into an assisted living facility, no medical plan covers that. And home care, if you need home care, they will cover you to an extent if it's for medical reasons, physical therapy, treatment in the home. They do not cover someone to come in and help you with day-to-day activities on these plans. And that's where the home health aid comes in, or home care comes in. And this statistic just completely opened my eyes to this industry, and why this is important is 7 out of 10 people will require assisted living care in their lifetime. Let that sink in for a second. 70% of people in their lifetime will have to require assisted living. That's a crazy statistic. That means most people here that are going to be aging and getting onto Medicare or an employer plan will need access to this and will have to require that type of care. So what happens in most cases? Well, most cases that I have seen personally, people haven't planned for this. And what happens is, after the medical plan covers what they will, if they cover anything, they now need to tap into retirement accounts, savings. And they start to liquidate their assets to pay for these type of services. And that nest egg that they've built up over time is now going towards all these health costs for this skilled nursing and assisted living care. And that, folks, is the #1 reason why people run out of money in retirement. I'm a retirement planner as well. We have Medicare Joe as a business. We have Retire with Joe as a business. And in our retirement planning conversations, we're talking about this, making sure that they know that this is an exposure, so that way they don't run out of money in their retirement. Now, there's been solutions that have been presented to a lot of folks probably over time, and the most common one is long-term care. And if you've subscribed to my channel, or if you've watched any of our Medicare videos, I am not the biggest advocate of long-term care. Sure, it serves its place, but in my opinion, it's very expensive. For folks that are 60 to plus, it's going to be $500 to $600 a month. It's tough to qualify for. There's a lot of health underwriting, et cetera, to get the plan. But the cost is the biggest one. I mean, you're paying $500 to $600 a month, which a lot of people just don't have to put towards a product. What I am a big advocate of, and what I think makes the most sense for anybody that has a medical plan that's 60 plus, is recovery care, short-term care. So long-term care covers you for more than 2 years. The short-term care has to be under that 2-year window. And why is that important for you, and why is it relevant here, is because the average assisted living care is for 27 months. So 3 months more than the 2-year window. So the 2-year window offers great value to somebody, given that that's the average stay of an assisted living care is 27 months. So with these plans, another big reason why I'm an advocate for them, there's no physical that's required. I mean, ultimately qualifying for the product is just answering 10 yes or no health questions. It's as easy as that. So a lot of people can still get in there with their fair health or good health to buy the plan. And let me just sidebar for a second on that. A lot of people may be thinking, well, I don't need to worry about this now. The problem is that that's everybody's thought process. And a lot on the life insurance side, we see people that aren't thinking about life insurance because they don't need to worry about it right now. And then we send out an email to folks, and all of the people that had something happen medically to them, they call us for life insurance, but they can't qualify now. So it's that old adage of, it's not going to be a problem today, so I can put it off to tomorrow. Well, that's not always the case. The reason why these plans exist now is so you can take action on them while you're still in good health before your health deteriorates. So again, sorry for that sidebar, just wanted to get that out there. But with this product, the recovery care product, there's 2 options that you can pick from. And the best value, the best bang for your buck, if you will, is the in-home and in-facility plan. The way this covers you, it covers you for 1 year in the home and 1 year in the facility. The total payout over the 2 years is $206,000. And the price for that is about $140 a month. So just under $1,700 a year. And think about that for a second. You're getting $206,000 in coverage for the 2-year plan. And your cost on it is $1,700 a year. You'd have to pay premium for more than 120 years before you outspent the plan. It's never going to happen. You're basically paying pennies on the dollar today for the coverage. And a lot of our retirement planning folks see that. You pay very small premium today for larger payout in the future to cover you. Now, I understand that some folks might not be able to afford that every month, and I get that, and that's the best value plan, but there is another option, and something is always better than nothing. The other option is the in-home plan. And the in-home plan covers you for 1 year of in-home care. The total payout for that is $62,000, and the premium on the plan is $50 a month. So again, $600 for the year in premium. So that's another 100-year break-even point. You're paying a fraction of what they're going to pay out for you now to cover you in the future. Now, to qualify for these benefits, you don't need to have a medical event trigger this. I mean, ultimately, these plans will pay out if you just cannot perform 2 out of the 6 daily activities of living. That's it. As soon as you cannot perform or need help with 2 out of the 6 daily activities of living, you qualify to tap into these benefits. And for people that are getting older and as they age over time, that's a pretty easy requirement to satisfy to get the payouts. A big question that I get a lot is, Joe, well, why should I do this now? Right? Well, I'm healthy. Again, your health is what qualifies you for this plan. You're never going to be as healthy as you are today. But the other part on that is the cost. These are issue age plans. And as you age, if you put this off, that premium jumps about $300 a year more, depending on the age increase that you're looking at. So not only are you looking to possibly pay higher premiums in the future for life, you are also maybe never be able to qualify for the plan. So again, we always tell folks to worry about it now, because this is the time you're transitioning with your coverages. This is the time that it makes sense to look into a product like this, because If you haven't before, now's the time too. It's a very important product to understand and have a part of your portfolio. So like I mentioned, we do retirement planning. And on these calls, we have our Medicare Joe business, we have our Retire with Joe business, but I use this recovery care product with every retirement proposal. The reason is folks that have built up a nest egg understand that they do not want to have to pull $100,000, $200,000 or more from their retirement accounts to pay for this kind of thing, and they're willing to pay a pennies on the dollar for coverage today to cover that nest egg and protect it in the future. Now, again, if you have questions on the product, feel free to post comments below. But I just wanted to end with this, that the reason I'm so extremely passionate about this is because we deal with Medicare every day, and Medicare really falls short on this coverage. They're dialing back the coverage on it every year, it seems like. They just reduced it last year. But any medical plan, Medicare, you're delaying Medicare and you're going to stay on an employer plan, retiree plan, you need to look into what this is, why you need it, because it can cost you hundreds of thousands of dollars in the future. And nobody is talking about it. It doesn't make any sense to me. We're setting people up for coverage for a primary care doctor copay or a specialist copay, and we're completely not looking at the thing that can cost us $100,000 if it happens to us. It just doesn't make sense. So I'm trying to break that trend. Maybe that's why it seems like I'm a little over passionate in this video here, but I'm trying to break that trend, bring you this information, and change that so more people can start talking about this topic with their clients. So again, if you've enjoyed this video, please give us the like button at the bottom of the video. That basically tells YouTube we're doing a good job and gets our content out to more people so we can help educate them. If you have questions, feel free to comment below. Our number, I just displayed it on the screen. You can give us a call there with any questions as well. And again, if you want to be updated when we post new YouTube videos, click that red subscribe button in the bottom right-hand corner, and you'll be able to be notified as we post new YouTube videos. Again, thank you for watching. Medicare Joe here. Take care and have a wonderful day.